So, welcome everyone to tonight's Spotlight on Health, sponsored by the T. Colin Campbell Center for Nutrition Studies, otherwise known as CNS. My name is Natasha Lance, and I'm the Executive Director of Core Operations at CNS. And I have the distinct pleasure of welcoming you this evening, going over a few small housekeeping details, and then I will hand it over to this evening's host, Dr. Mike Hawley. So, all of you, please know that you will receive the replay for this session 1 week from today, and check your email because it might go to your spam folder and you want to check there just in case. For those of you who might need closed captioning this evening, if you go to the bottom of your Zoom screen, there is a small box that says CC. Click on that and then you will get closed captions. And then for those of you who have questions for tonight's presenters, which I certainly hope that you do, there is a Q&A at the bottom of your screen. Please drop your questions there. I'm going to be gathering those questions and then we will ask them at the end, as many as we can. So please do put your questions in that box. There is no chat on this evening because we want people to really focus on our presenters and what's being talked about and come up with those great questions that you have. So again, we welcome you this evening. We're so glad that you're with us. I'm going to hand the microphone over to Dr. Mike Hawley, who is the head of our medical advisory board at the T. Colin Campbell Center for Nutrition Studies. Dr. Hawley, it's all you.
Thank you, Natasha, and welcome everyone. I'm so glad you're joining us for this version of Spotlight on Health. We're going to be talking about raising healthy plant-based kids. And we have two esteemed pediatricians with us tonight. Dr. Leigh Ettinger is a pediatrician at the Children's Medical Group in Kingston, New York. He's board certified in pediatrics, pediatric nephrology, and obesity medicine. His medical interests include nutrition, obesity medicine, kidney disease, and hypertension. He's presented on these topics to community groups and at local and national medical conferences. His commitment to excellence is underscored by the continuous recognition as a Castle Connolly top doctor, a peer-nominated accolade he has received yearly since 2014. In addition, Dr. Ettinger serves on the medical advisory board of the T. Colin Campbell Center for Nutrition Studies and as a moderator for the CNS Whole Communities online forum. Outside of the office, Dr. Ettinger is an avid cyclist and he really enjoys adventure travel. In the past few years, he's been backcountry skiing in Yosemite, bike touring in the Pyrenees Mountains, caving in the lava tunnels of Iceland, and hiking in the slot canyons of Escalante National Park, Utah. Dr. Rikin Patel is a board-certified pediatrician and lifestyle medicine physician. He currently serves as an assistant professor in the Department of Pediatrics at the University of Toronto and leads pediatric education at his hospital. He completed his pediatric residency at Memorial University of Newfoundland and the plant-based nutrition certificate from the T. Colin Campbell Center for Nutrition Studies. Dr. Patel is dedicated to promoting wellness within the medical community through innovative approaches, including medical improv, meditation, and plant-based nutrition. He founded the Reset Pediatric Lifestyle Medicine Clinic, where he integrates evidence-based lifestyle interventions and promotes whole food, plant-based eating patterns to reverse and prevent chronic disease among children. With over 35 years of martial arts experience, he is also a Shaolin Kung Fu instructor at the Waterloo Kung Fu Academy. He has had a dedicated meditation practice for the last 20 years, and as a certified yoga instructor, he enjoys teaching university students and fellow healthcare providers. Welcome, Dr. Ettinger and Dr. Patel. Glad to have you both with us tonight.
Thank you for that kind introduction. Thanks for having us here.
Yeah, thank you, Michael. It's really nice to be here.
Absolutely. So, Our topic tonight is one that we're often asked about. When we talk about plant-based nutrition and whole food plant-based diet and all these things, a common question is, what about the kids? Is this safe for the kids? Are they going to get enough, protein, or what are the things we have to worry about? You guys are going to tell us tonight what we have to worry or not worry about. So I want to start with the little guys. What potential areas of concern should we be concerned with in raising a baby or a toddler on a whole food plant-based diet? And whoever wants to jump in first, and then the other person can tag on after that.
I'll go ahead and start, Leigh.
Sure, yeah, please.
So thanks for the question. I think first of all, just to highlight that a plant-based diet or a plant-focused diet has been certified and recommended, approved by both the Canadian Pediatric Society and the American Academy of Pediatrics, as well as the Dietitian Society, both in Canada and the US. So we know that it is a healthful diet at all stages of life. And I would say in kids, starting off with the younger kids who are infants and toddlers, some of the things that we need to be mindful of are specifically certain micronutrients and vitamins. And I think specifically in the younger kids, because brain development is such a big, important concern, I would say the three things that come to mind when we're talking about the younger infants and toddlers is first is iron. Iron we know is really important for growth and early brain development, and not only just the formation of our red blood cells, which helps transport oxygen throughout our body, but having adequate iron in our diet is really important because of that important aspect for brain development. The second is vitamin B12. I think that's also a very important vitamin to consider when we are on a plant-based diet because of its importance for nerve tissue health, again, early brain development, and red cell production. So again, vitamin B12 is really important to consider. And then the third nutrient that I also think about when I think about the young toddlers is omega-3s, because omega-3 is also important for eye, brain, nerve development. And so when I think about this early, age, on top of all the, regular things we think about, I think these three things are important. And then one other thing that is important to highlight for the younger kids, again, in context of brain development, is the amount of fat content they should be getting from their calories. So generally when we are, older teens and adults, typically the amount of calories that should be coming from fat, about 10 to 15% of our calories. But when we're younger, especially in infancy and early childhood, it should be upwards of 30 to 40% of our total calories coming from fat. And I think that's important to highlight also when we're dealing with the, that specifically that younger infant to toddler range of kids. So that's just to start.
Yeah, great start. Leigh?
That's great. In my practice, I haven't yet had a family come to me and say with an infant or toddler, like, we're gung-ho plant-based and I need to know what to do. But what I do have in my practice is a lot of milk protein allergy in the infants and toddlers. So that is when the formula is a milk-based formula and it's causing a lot of gassiness, some diarrhea, poor sleep, and you can actually test the diaper and find some blood in the poop. And so for those babies, we want to switch them away from a milk-based formula to a soy-based formula. And I'm starting to have conversations with the family about the the dangers of dairy, and especially as they become toddlers, and the families are always asking me about transitioning from the formulas or the breast milk to the cow's milk. And that's when I start to have conversations with them about that they don't actually need cow's milk. You talk about expecting that 68% of the world's population is lactose intolerant. And, I say to them, hey, do you ever notice that Chinese food doesn't have any cheese on it? And that's because there's 1 billion people in China that are lactose intolerant and can't eat the cheese, can't eat the dairy. And the interesting thing is that there's observational studies that show that their elderly have less hip fractures than the elderly in the United States. So even though they haven't had dairy their whole life, their bones are still quite strong. So I just start to have conversations with families about reassuring them that the baby doesn't need cow's milk and can be healthy without it. And the American Academy of Pediatrics only just recently started to say for families that do have a lactose intolerance that soy milk is a equal alternative. So I start to try to get families interested in the soy milk instead of the cow's milk.
Yeah, excellent. Dr. Patel, I want to come back to your three nutrients. You mentioned micronutrients. You mentioned iron, you mentioned B12 and omega-3. With the exception of the B12, we know the whole food plant-based diet has those nutrients. I guess I'm guessing the concern may be quantity. Are they getting enough quantity of the foods that contain the iron and the omega-3? Expand that a little bit for us.
Yeah, sure. So with as you mentioned, I think in terms of what you're getting at is, with B12, generally, if you're on an exclusive plant forward or plant-based diet, then supplementing with B12 would be important, or at least making sure that all the foods that are being eaten are fortified.
Right.
The other vitamin that comes to mind is vitamin D as well, especially in that younger age group. But again, throughout all age spans, B12 and vitamin D are important to consider. But then, yes, with the other two nutrients that you're mentioning, iron and omega-3s, these are definitely ones that we can get in our diet. With iron specifically, I think it's important to always consider that iron needs vitamin C to be absorbed, so that we should be mixing our iron sources with vitamin C. So vitamin C, I think about foods such as like orange juice that help the absorption of iron, bell peppers, tomatoes, again, foods that are higher in vitamin C, which also help that iron absorption. And then with our omega-3s, because with our omega-3s, a lot like if we're on a plant-based diet, uh, because some of the main natural sources are coming from, for example, like seaweed, the precursor linolenic acid, we have to focus on that we can get through soy products, flax seeds, walnuts. And so there are really good sources that we can derive those. So necessarily, and again, with omega-3, there's no RDA or recommended dietary intake for that. In kids, but I think again it's important to note, as you mentioned, that these can be adequately found in our diet, but we have to be conscientious about the foods that we're eating, how we're pairing foods, again, and that's where always when the recommendation comes that this can be done, in a way that promotes growth and development and good health, well planned is the key here, and so we just have to be conscientious of the foods that we're eating as well to make sure we're getting everything.
Yeah, you mentioned a phrase right there, well planned. That's one of the phrases that we often talk about. If well planned plant-based diet, in other words, if you're not eating just iceberg lettuce and bananas,
Mhm.
well planned that's balanced between your fruits, your vegetables, your whole grains, your beans, the nuts and seeds and that sort of thing as well. So that's a very good point. And I'm curious for both of you. Um, with the exception, again, vitamin B12, you mentioned that. Are there any supplements or vitamins that you routinely say, all right, you're plant-based, I need you on this or that? In other words, vitamin D, or is there anything else that you would recommend for the growing toddler as far as supplement they may not get from the whole food?
Yeah, for
So
me,
if sorry, go ahead, Lee.
Yeah, for me, it's just the vitamin B12, and then in this hemisphere at this time of year, especially vitamin D. I think those are the important things. As the kids growing up, there are routine checks for anemia in the younger kids and in the teenage girls. So if we're finding that they are developing any kind of anemia, then I recommend, I know some of my colleagues will be recommending eat more meat, but I have handouts about iron-rich plants, and I can also recommend iron supplements. So I just kind of take a different tact without being too preachy about it. I'm like, oh, here's some good sources of iron, or you might want to consider a supplement if I do find some iron deficiency anemia. And by the way, that's not in the vegan kids, that's in all the kids
Yeah.
that we're finding that.
Yeah. I like that approach, Leigh. Yeah. Dr. Patel,
Yeah,
anything?
no, I agree with both of them. I was just going to say, as long as iron levels are okay, that those would be the only two recommendations I have are B12 and vitamin D.
Okay.
That's it.
Great. So if we move a little further into childhood, the school-age kids and the teenagers, what, if anything, changes, or what specific recommendations do you have for that population as they embark on a whole food plant-based diet in the school-age, group?
Leigh, you want to start?
Okay. Yeah, yeah, I'm always surprised and pleased when a family kind of volunteers like, oh, little Sally wants to be a vegetarian or so and so has been vegan for 5 years or something like that. And I'm always I try to really encourage them, applaud it. I know maybe some pediatricians are like, oh no, that's going to make you sick or deficient or something. So I'm always trying to positive. I share my own experience and really try to support the family, try to explore why. And for the younger kids, it's often all about the animals, and I support that. And I just try to give resources. I have limited time to really go over a lot in the clinic, unfortunately. So I just want to make sure that they are finding resources online that are valuable and I guess official, and not necessarily just reading stuff on various social media. So I kind of want to guide and direct them and make sure that they're getting good sources like Center for Nutrition Studies, for example.
There you go. There you go. Yeah. Dr. Patel, how do you handle it?
Yeah, so I think just, as three kind of guiding principles for families that I go through is one, first, always looking at a plant forward or plant-based diet to promote optimal growth and development. And so we know that we have plenty of research to uh, show that this type of diet promotes, is fine for adequate growth and development. So first, that as a first overall concept is really important. The second is making sure that the diet that's chosen is preventing or dealing with any like immediate childhood needs. So, for example, preventing iron deficiency anemia, preventing dental caries, cavities, watching out for over and undernutrition. And that also gives me an opportunity to just speak to the point that right now we're in a situation, we're in a stage of society where a lot of kids, most of their foods are coming from ultra processed food, and watching out for that overnutrition and ultra processed food. So that's the second guiding principle of just prevent immediate childhood health concerns. And then third is promoting a diet and establishing eating habits that are going to prevent chronic diseases, such as heart disease, type 2 diabetes, obesity, hypertension. So those are just kind of three guiding core concepts that I introduce to families right up the upfront. But I think, again, trying to emphasize that families can get all of their nutrition from whole foods, trying to increase the whole foods as much as possible because usually they come with a lot of fiber, explaining why fiber is so important in our diet, as well as just watching out for ultra processed foods because they're packed with the three main ingredients of sugar, salt, and fat. So that's just a high level approach that I usually start with families to get people started and just help families understand some of the challenges of that it's not always easy in today's world where even going to the grocery store can be a minefield, and that I think reading labels is food labels is something that we really promote in our clinic because I think that knowledge is a tremendous power for families to make better choices.
Yeah,
Uh,
excellent. It's amazing to me how many kids are growing up on chicken nuggets and macaroni and cheese and they grow, you know, in the wrong way.
Yeah.
And unfortunately, they have other problems. But yeah, it's amazing how the world is today with kids and what they eat.
Mhm.
That, if I may add, I also
Please.
have my interest in obesity medicine and board certified in obesity medicine. And in my practice, there are 22 other providers, and I've given talks to them about the plant-based diet, so they know that I'm available. And thankfully, when they're seeing a child with obesity, they're referring to me. So I have a little mini obesity clinic going on, and that's when I really try to, for families that have never even heard of the plant-based diet, introduce these concepts, the plant forward diet, plant predominant diet, filling up, like as Dr. Patel said, on high fiber, high water content foods to eat more foods even, but get less calories and feel full and satisfied. So that's enjoyable for me, an opportunity to kind of introduce the plant-based diet when a family is struggling with obesity or pre-diabetes or even elevated blood pressures from their diet. So that's where I can really introduce these concepts too.
Excellent.
And just
Excellent.
one more thing I wanted to
Yeah.
add is a great place to start for any family, whoever, whichever family is trying to share this information with others is our food guidelines. It's a really simple, easy place to start. I know here in Canada with the plate method, half that plate is fruits and vegetables. And so, and then obviously now like water is a beverage of choice. So again, just going through this guidelines, and I start as young as age of like pretty much like after one when they're transitioning out of either breastfeeding. Start as young as possible and start with these food guidelines as a starting point, because usually a lot of families compared to when we were younger, the food guidelines have changed a lot, and just informing families of these changes I feel is like just a place to set a foundation early in their kids development.
Yeah, excellent, excellent. Yeah. So I hate to go here, but we have to do this. We have to talk about protein, right? Because anybody that goes on a plant-based diet, their friends always say, "Where do you get your protein?" Right? And so parents are going to be concerned, my growing child, my growing teenager, my athlete teenager, how do they get adequate protein on this whole food plant-based diet with no meat? So talk to us about that.
How much time do you have? I have a
Yeah.
long rant about protein.
We
It's
we
this
have
is
to we
a
have to go there and
uh,
mention that P word, the protein word. Yeah.
right. So yeah, if I have limited time, I'll just be like, well, where do you think the cow gets the protein from to make the juicy steak? It eats grass, it eats corn, it eats grains, it eats soybeans. You're going to eat those things too, and look at how big the cow and the ox and the elephant and the brontosaurus get eating those plants. So you can get big on plants, and that's not such a concern. And then I also reassure families that the World Health Organization looked at what to do with kids that they were finding in the developing world that were malnourished, um, how to best feed them. And they tried higher protein diets or higher protein foods with those malnourished kids. And they found that since we don't get energy from protein, that those kids were just still lethargic, low energy, and were not growing as well because they were just not thriving. And so the World Health Organization, when they made these programs and food plans for these kids who were malnourished, they said, put the protein away. We need to get these kids carbohydrates and fats that'll give them energy, that they start running around more, and that actually increases their appetite, and they start to eat more, and then they're thriving. So if a child that's malnourished in the developing world is given a lower protein diet, why would anyone in the developed world, why would anyone in my community who's probably, has a high percentage chance of being overweight, why would that person need more protein? Uh, I, I can go on about the athletes and stuff like that, but I want to give Dr. Patel a chance to. So,
Yeah, I think, thanks, Leigh. That's a great start. I think it's important for families to understand also, because I think there's a little bit of a misunderstanding here, is that the plant proteins, similar to the animal protein, has all 9 essential amino acids. And so the quality of the protein is just as good. And I think that's really important to emphasize up front. And that we have good research to show also that even if whatever type of varying diet you're on that's, plant forward, plant strong, uh, that the research is, showing that the protein intake of these types of diets still showed to be, up to double the required intake. And so we know that even if you're like the varying types of plant diets, that you usually are getting more than enough protein on this type of diet as well.
Yeah, exactly. I just refer to my children. My children are young adults now, 32 and 34, and both of them are extremely muscular and well built. And I said, they build their muscles on plants, not meat. They don't do dairy. They don't do eggs. They're purely plant-based. And look at these two guys, and people's like, how do they do that? I say, beans have a protein, whole grains have protein, vegetables, they have a little protein too, and they're like, what? And again, it gets back to that well-planned diet that Dr. Patel mentioned. If you're not eating just, lettuce and bananas, you're going to get all the protein you need if you're eating a well-planned and well-balanced with lots of beans and grains and nuts and seeds and all that good stuff. And yeah, so thank you for clearing up the protein issue. I want to go back to something Dr. Ettinger was talking about because it's a real problem in our pediatric population, and that's overweight and obesity. It's really increasing in the pediatric population. And so, both of you, how do you prevent and more importantly, reverse this lifestyle condition? Because we have a lot of kids that show up in your clinic overweight and already obese, so you're in the reverse mode. You like to be in the prevent mode, but sometimes that's a little difficult. You don't get them early enough. But so, how do you both of you approach the overweight and obesity issues?
It's a challenge for sure. What I do is at the well child checks, I will often ask the young person to leave the room because I know it's a sensitive topic and certainly don't want to trigger any anxieties or kind of eating disorders. And I'll just ask the parent or guardian in the room, and I'll just show them the growth chart. And you can see the lines are too high on our electronic health record. It's red. So I just say, hey, look, your child's up here. That's above the desired range. In this range, is that a cause of concern for you? So it's not judgmental. It's just like, hey, how are you feeling about that? And I get various responses. A lot of times, the parents are like, oh, I had no idea. And there's actually studies that half of parents don't, because of the obesity epidemic, half of parents don't even recognize that their child's overweight or obese, or I'm sorry, has overweight or has obesity, because, looking in the classroom, they might be the thinnest kid in the classroom. So half the time that can even be a surprise to the parent. And then sometimes the parents will say, oh, real kids have curves, or, oh, all my kids are that shape. And then when they go through puberty, they sprout up. So, but then for the families would say, oh yeah, that is a concern. Aunt just got diagnosed with diabetes, and this, there's something on the parent's mind. So that's the family that I'm like, well, this is an interest of mine in nutrition. I'm happy to talk more. Why don't we do some blood tests today? We can see where he's at with blood sugars, things like that. And then invite them back. And I have nutrition consults where I can just sit down with the family and with the child in the room and kind of talk through how we're going to best address this.
So you identify the problem, then bring it back so you can, focus on that issue.
Yeah, and it's interesting, some families are like, oh, I'm so glad we found you. This is exactly what we need. And I never see them again. They leave and they don't make that appointment. So yeah, but then some families are like, yeah, let's work together, and then they come back regularly. But it's an interesting dynamic, and it's a challenging problem. I kind of liken it to the I guess they say the retirement crisis. Like, people aren't saving enough money for their retirement. That's delayed gratification. You have to make changes now so that you have financial health when you're elderly, and people don't have that long-term horizon on their mind necessarily. Likewise, you're making changes in what you're eating today so that you could be physically healthy in your elderly elderly years is important too. But people, we just don't, it's such an abstract thought. We don't think that far ahead as a species. So it can
Yeah.
be a challenge.
Yeah. Very good point. Dr. Patel, how do you handle the overweight and obese child in your practice?
Yeah, thanks for that. And thanks, Lee, for your response. I was just, I think for this type of approach, I think the age of the child matters, because I think depending on what age they're at, it changes the focus of, are you speaking more to the parents versus, if they're older, and if I ask them if their health is concerning to themselves and they actually say yes, then, exploring what it is about it without kind of, labeling it or just putting it on them, I think
Sure.
is really important, letting them come to understand what their concern may be. Because then once I understand what their concern may be, then I'm trying to establish, their why for why they would want to make a change. And I think that's really what I try to go through early on in the visit is, trying to cling on to something that is important to them, as the basis for how we can put, why we'll take on these suggestions or make some changes. So I think examining the age of the age of the family, obviously if the kids are younger, I really, really emphasize to the family that although you've come here for your child, I want you to see this as an opportunity for the whole family. And I think this is really important because that having the whole family on board, the parents modeling is really, really critical to addressing this issue, because it's really, with children being at the stage in life they're at, they're very much dependent on their home environment, what's in the house, how what the parents are doing themselves. So really, really trying to get the buy-in from the parents, which generally I will say that because we, at the natural affection that families or that parents have for the children, I think that's an important factor for us to consider as providers, because we can harness that to, when parents sit down and say, hey, like if this is going to be important for them, I'm willing to consider it for, I'm willing to make this change myself for them. Not done it for myself, but again, really trying to harness that relationship that the parent has for the child, the concern that they have, to really try to help move the needle on what is a very tricky and sensitive issues, because there's a lot of factors involved. The the parents' lifestyle, the parents' habits growing up, what the home environment is like, how many other children they are. Yeah, it's what who's doing the cooking in the house. What exposure do the children have to what are their experiences outside of the house. So there's so many different factors going on, and it's not, it's something that definitely takes time. But again, the first principle is just looking at, the age of the child, involving the parents or the older children as much as possible in the process. And then secondly, really trying to kind of engender the family to see this as something for the entire family and not just the children. Because I think, the wonderful opportunity we have, specifically in this context of weight and obesity, is that if we can focus on the child, we have a chance to take the whole family with us.
Yeah, those are excellent points. And as you both know, weight loss is a complex issue. It's not just, I mean, it starts with what you put in your mouth, but if you don't understand, like you just said, the family dynamics, the family history, what it's like at home, what they're like eating at school, all these things come into play, and it's complex, and it's something that's not going to be fixed, with one session. We just did a 6-week weight loss seminar, and I was, giving talks each of those 6 nights, and each night was a different component of weight loss. I stressed, fiber's your friend and oil's not your friend, and things like that as far as diet. But we talked about, behavior things and activity and all of these things that are complex. And as most pediatricians in a 10-minute session, they don't have time for this. And frankly, sometimes they don't have the knowledge for all of this. So I appreciate what both of you are doing. Any other comments on that before we move on to something else?
One thing I wanted to add is just a practical tool that uh, for families when they come in. Obviously, we're talking about what they're eating, but seeing everything kind of in the context of other lifestyle factors, but particularly sleep. Sleep is one thing that I try to address right up front. And I try to connect that the way you're sleeping and how well you're sleeping is actually very much connected to what we're putting in our mouth. Because when the brain is better rested, or, we know that this part of our brain, the executive functioning, can make better decisions about saying yes to the good things, saying no to the things aren't so beneficial for us, and really talking about how the appetite hormones in our body, the satiety hormone of leptin, ghrelin, these hormones are better regulated when we are sleeping better. And so really in addition to trying to make the changes that we can for diet in our initial visit, I think uh, really targeting and going right at the sleep. I do that right from the first visit, right up front, because that's going to really make all the changes we're trying to do easier if we're trying to address this, which again also brings up other challenges of having to deal with media and screen time and other things. But I really think that if we can get sleep on track, it gives us energy to do more physical activity, and it also can help us make better choices for what we eat.
Yeah, very excellent point. Thank you, Dr. Patel. Patients come to me as an immunologist. They want to know why am I sick a lot, and I start with sleep. I get to nutrition, but sleep is the number one thing I focus on for the immune system. So yeah. Anything else, Leigh, from you?
Oh, I would just add that sometimes even with a child with obesity, weight loss isn't necessarily the goal because we don't want to restrict calories and nutrients too much because they're still growing. So sometimes the goal is actually weight maintenance and letting their height catch up to their weight.
Sure.
So that's important too. That's a fine kind of dance to do also with the families so that we have good, healthy goals.
Yeah, thank you. That's an excellent point. Um, Type 2 diabetes, more common in the pediatric population than it was, 20 or 30 years ago. So, how do you address that as far as preventing, reversing, and managing type 2 diabetes in the pediatric patient?
Yeah, when I was in medical school in the 90s, it was called adult onset diabetes.
Yeah,
And
yeah,
yeah, then it became kids with this condition. And what's helpful is that in the past it was thought to be incurable, but people are now understanding that with diet and lifestyle, it can be cured, and especially the plant-based diet. The plant-based eating pattern, and there's lots of studies that demonstrate it. And I try to educate families. There's such a fear about carbohydrates,
yes.
such a fear about carbohydrates in this country. I had a child, a 6 or 7 year old. He was vomiting and diarrhea for days in my office, and I'm encouraging. He's starting to feel better, and I'm talking about let's rehydrate with Gatorade, and the mom says, but Gatorade has a lot of sugar.
Yeah.
I'm like, well, yeah, he needs sugar now because he's been vomiting and diarrhea for something. And there's just such a fear of carbohydrates. But as you learn, it's not the carbohydrates, it's not the sugar that causes the diabetes. That's like the effect. And what is causing the
Right.
diabetes is a fat
Fat.
in the muscle and liver cells. And so when you're decreasing the fat in the diet through the plant-based diet, because you're taking all the animal fat out, that can really improve diabetes and pre-diabetes. And so that's why I'm trying to correct these myths that these families have and guide them in a more plant predominant eating program.
Yeah, and that's an excellent point. I mean,
Yeah.
I often ask patients that, they come to me for lung problems, immune problems, but they'll say, I was just recently diagnosed with diabetes. And I say, well, tell me about that. What did your doctor say? Well, they say, I need to stay away from carbohydrates. And I say, well, and I give them the fat talk like you just did. And they look at me like I'm crazy. So, anyway, Dr. Patel, what do you think?
Yeah, that point that Leigh made, again, just reframing the problem of type 2 diabetes not being a carb issue, but being a fat issue, and just explaining the mechanism that actually when you have too much fat around your cell that, insulin can't work. And so as soon as we're reducing specifically our saturated fat intake, this can really make a big difference of, reducing our risk for type 2 diabetes. And then in addition, I think also educating people on carbohydrates and really explaining the difference between refined and complex carbs. That complex carbs are actually what we want. We need carbs. Everyone needs carbs in our diets, the majority percentage of calories in our diet, but it's the type of carb. And so really focusing, that's where I really try to emphasize foods high in fiber, and any food that, is high in fiber is gonna, that fiber effect is also gonna help mitigate the sugar spikes in our body and, insulin levels. So again, reframing their understanding of type 2 diabetes, also trying to educate, re-educate on their understanding of carbohydrates, which a lot of people, again, carbs can get a bad rap, but I think the type of carb needs to be elaborated on. And yeah, I think that's a really good place to start, and really just emphasizing that we have really good research to show that, those on a vegetarian plant-based diet, the incidence, the risk of developing type 2 diabetes is like half, less than, 50% less when we can adopt this type of diet.
Yeah, excellent. Thank you. Thank you, Dr. Patel. Um, let's talk a little bit about growth patterns. Are there different growth patterns for plant-based children versus the meteors? What do you see?
Yes, with a caveat. So it's been shown in some studies that the plant-based kids grow a little slower, but because they're not exposed to the dairy and the hormones and the animals, their puberty comes a little later. So their growth plates fuse a little later. So they catch up later in the teenage years with their height, where their meat-eating peers have gone through puberty a little earlier. And over the past several decades, puberty in girls especially gone down, which means that their growth is slowing earlier. But those are the studies. But I'm going to put a caveat in that those studies were done decades ago, before plant-based burgers and Ben and Jerry's plant-based ice cream, before all these highly processed and highly caloric foods. So I wonder, there's no studies right now, but I wonder if you're now like vegan or plant-based and you're eating all these easily available, highly processed like animal replica foods, that if your growth would not be very similar to the omnivorous kids these days. I'm curious. Maybe it'll be studied, maybe not.
Yeah, good point. Yeah. Dr. Patel, what do you think?
Yeah, I mean, just building on what Leigh was saying, that with the kind of the timeline slightly differs, but we do know that those on a meat and a plant-based diet, the study that's very like most often quoted, I think, in this regard is the Vecchi study out of Germany, where they did look at growth parameters in many people, that showed that height, weight, everything was fairly similar for those on a variety of plant diets, and that there was really no change in growth parameters between the different populations. So the researchers there, again, as Leigh mentioned, they are older studies, but I generally convey to families that from a growth perspective, they can expect to be quite similar or just as equal as their meat counterparts.
Yeah, good, good. I'm going to give you one question from our CNS community. Natasha will have more. And then I want to have each of you talk a little bit about your clinics and how you incorporate things. In particular, Dr. Patel, you have a unique practice in Canada. So want to talk a few minutes about that. So this is from one of our CNS community audience. The question was posed, and it kind of related to what Leigh was talking about. For plant-based teenagers, I like this, is there a ratio of junk plant food to whole food plant based that is safe for good health? And how much vegan junk food cheating should we allow our teenagers to do? So take that and tell me what you think.
I guess it depends on what the goals are. If the goals are animal welfare, for example, then any ratio is good. But if there are concerns about health, if there's concerns about weight, if there's concerns about blood pressure, if there's concerns about blood sugars, then I'm afraid the plant-based junk foods would have to be cut back.
Yeah.
Mhm. Yeah, I was just also going to add that depending on what the health status is of an individual, I think if someone is generally healthy, in today's world where there's, it's hard to get away from, uh, processed food. I generally still with my families will talk about the 80-20 rule that 80% of the time if we're doing things, well and as best as possible, that 20% of the time, that there is an opportunity for, potentially like the vegan junk food. But we do know that we do know that there's research to show that even people that are doing a plant-based or like a vegan diet, that the food is highly processed, that their risks are just as high for cardiovascular disease as the meat eaters. So again, uh, again, depending on the health status of the individual and what the specific concerns are, we go accordingly. But in general, I think, for the younger kids, I think that there should be a place for having the opportunity to have what they like, if we're doing things well most of the time.
Yeah, yeah, that's an important point. And, I always tell people too, if we, foster the taste that, it's sugar and salt and oil, then that's what they're going to want. If we foster, the whole food plant based, they're not as interested. But it's going to come out in life somewhere, school age, maybe parties, that kind of thing. So, yeah, we have to be prepared to maybe give a little bit, that 20% that you were talking about, Dr. Patel.
Mhm.
Yeah. So we have about 8 minutes left. I want to start with you, Leigh. You've been alluding to it in some of your answers, but in general, how do you incorporate lifestyle medicine in your practice? In other words, for me, not every patient that I see, I talk to about, lifestyle medicine. Others, the door's open or, wide open. How do you incorporate it in a nephrology practice?
But yeah, I was working at a major medical center for 16 years as a pediatric nephrologist and also worked in their pediatric weight management program, but then left and now I'm doing just general pediatrics. And yeah, a lot of my day is ear infections and immunizations and school forms and things like that, ADHD. But when I can, I'm seeing patients that either are from my child check panel or from my colleagues' panels for obesity. And that's really when I get to sit down and block off some time and talk to them and introduce them to plant-based concepts and really trying to work with them on their eating. Um, and other than that, if I do see an opportunity, for example, about the dairy,
Yeah.
because the dairy, it causes so many problems, eczema, constipation, anemia. So if there's something that's like just glaringly obvious, I'm like, oh, have you thought about stopping the dairy? Studies have shown that that can sometimes help. And some families are like, tell me more. And some like, no way.
Yeah,
But
right.
yeah, I just look for openings like that
Yeah.
with the families. Again, not trying to scare families away because the last thing you want is an online comment that go to if you end up in my office, you're going to be yelled at about the veganism or something like that.
Yeah.
So
Yeah.
I try to find line and I try to look for openings, but tread lightly.
Yeah, I like that approach and I do similar. Yeah, I like it. Dr. Patel, you have, in my words, a unique pediatric lifestyle practice. There's not many of those around the world, and yours is in Toronto, Canada, correct?
Yeah, we are
Yeah.
in Toronto, but right now the practice is fully virtual,
Yeah.
which
Yeah.
means that, on our team we have myself, we have a couple of social workers. For mental health support, we have a plant-based dietitian who's, willing to talk to people about a range of diets. But I've also come to see, because I still work in a lifestyle clinic that's focused on kids with obesity. I've also come to see that, you need other team members. And so we have a parenting coach on our team. We have a sleep coach on our team. We have kind of a behavior motivation coach. And these people actually can be accessed from anywhere around the world. And so the nice thing is that, in the age of virtual care, we're really trying to reach as many people as possible. So generally people would maybe get referred to me, and then I'll try to involve the other team members, depending on what people's needs might be, also what their means in terms of their capacity to pay for care. But one thing that I really like to do is for families that aren't able, other providers and coaches, is that we do online education. That's a big part of what we do at our clinic, where I pair up with our sleep coach, our parenting coach, our dietitian, and we do online education for families uh, who otherwise may not be able to afford our other members on our team. But when I'm there doing it together, we can usually cover through the national health insurance that we have. So that online education component is a great way for us to reach more people, but as well as I've come to see that in a group format, we really do get families also learning from each other. And I think that's a really powerful effect of lifestyle medicine approach that I've come to learn through my kind of training and learning of lifestyle medicine, is this group approach, where a lot of times where we may say things that may not land with families, but then a family member chimes in with their experience and it lands in a different way, with another family member. So we've seen that kind of actively being beneficial. And so taking advantage of both kind of the one-on-one, the team, and then the online group education is something that we're doing. And then now we're also in the phase, because we're a pretty young clinic, we're just over a year old. And so we're still trying to get the word out there about what we're doing, and then eventually, hopefully, trying to create education programs for disease-specific conditions, where people could sign up for like a 4-week or a 6-week, or a program that specifically would be for people with a certain condition, whether it be anxiety, constipation, eczema, uh, obesity, but have like a landing space for clustering groups of people, where we take them through specific things that would be focused to their condition. That would be a mix of both, hopefully, patients and parents involved.
Excellent. Excellent. Couple questions about that, Dr. Patel. Um, because it is virtual, is anyone worldwide, Americans, Europeans, obviously Canadians, eligible for your different programs, or what?
Yeah. So I mean, again, for myself, like in the context of, if people wanted to see me, it would be in the context, like if it was outside of Canada, then it would be in the context of like being a coach, and they could see me in that way. And I still bring all my experience, but just for kind of the technical purposes of licensing and everything else, it's just easiest done that way. And
Exactly.
otherwise, the rest of our team members are all, are really available to everyone, kind of anywhere, just depending on their means, for if they're willing to pay for the care, it's available to everybody.
Yeah. Yeah, I went in on your website and I was very impressed with the thoroughness of your approach. You're covering, parenting and sleep and the nutrition part and all. I mean, it was very, very good and very helpful for people. Could you give us your website so people that are interested can visit?
Yeah, sure. Is it a matter? Do you want me to post it here in the chat, or just leaving it?
Well, if you will, we'll give it to Natasha, and when she sends the replay out next week, she can put in the email with the replay?
Yeah, so if everyone wanted to go, like I just put it in the, I don't know if this is reaching everyone, but Reset Pediatric Lifestyle Medicine is the name of the clinic. And then on Instagram where we are, because we're trying to promote a lot of our online education in social media, but Reset Pediatrics is where they would find us on Instagram to follow what we're in terms of our education. And we have a lot of great, if people would like going to our website, because we try to put a lot of blog articles on different articles on lifestyle medicine. And although today the focus is nutrition, one of the reasons I wanted to start this clinic is because I think it's really important that nutrition's there, but we're also talking about the other pillars of lifestyle medicine, because so much of pediatric challenges these days are our mental health and, how we're sleeping, our physical activity, what our relationships are like with friends and family are really having a big impact on the younger generation. So I think trying to touch upon all of these points, and again, I always call lifestyle medicine a team sport. It definitely requires a team approach, and so I'm definitely not needing to be the solve for all of the challenges, and that's why we've really tried to build out a team to help as many families as you can in different ways. So families know that, hey, I know that this is my problem and I really just need this help. I don't necessarily need to be involved. They could go straight to one of our other providers.
Right, great. Dr. Ettinger, Dr. Patel, thank you very much for a very informative evening. We're going to invite Natasha back in, and Natasha is going to share with us some questions from our audience.
Oh my goodness. And questions we have. I must say I've been doing this for a long time, and the sheer amount of exceptional questions is over the top. So are you ready? This is going to be rapid fire. Let's keep them very concise, and we'll try to get through as many as we can. I think before that, before we get started, Dr. Patel, you mentioned a study in Germany, I believe, that was done on comparing the growth rates of children. Would you also provide that to me? And then I will put that in the replay because there's several people that ask for that. So I just want to put a link to it or reference to that.
Sure, yeah.
And
the
go
VECHI
ahead.
study, VECHI, if people wanted to just take a look at it.
And
Okay,
I'm curious,
gotcha.
what do you happen to know what year it was? Because I think those studies are older, right?
Yeah, they are definitely there. I know it is not recently, but I'm forgetting the year.
Right.
So Dr. Patel and Dr. Ettinger, you can get me anything that you want me to put in the follow-up email to everyone. If there's additional resources, happy to include any of that in your contact information if you wish as well. But let's jump in. And it seems like we're still getting quite a few questions, and I'm going to condense this, about soy and its safety. Not only for adults, but also for children. So very much, is it okay for infants? Is it okay for toddlers? Is it okay for teenagers? So could we address the soy issue just kind of to clear that up, the safety issue?
The concerns about soy, my understanding is it's been debunked. Just observational studies looking at the diet in Asian countries, which are have a lot of soybeans and a lot of soy sauce and a lot of tofu and processed soy products, that those countries that are eating culturally that way have 1/10 the breast cancer rate, 1/10 the prostate cancer rate of the United States. Now, yeah, certainly genes play a role in some of those cancers, but my understanding was that that it's not a cause for concern for promoting cancers or triggering cancers like that.
Yeah, and just to add to that, that soy is it's a phytoestrogen. So although it is in that class of estrogen, it's a fraction of the potency of the estrogen that circulates through our body. And in fact, that phytoestrogen can serve as what we would call a competitive inhibitor. So it can actually block the effect of estrogen, which is referring to what Leigh is saying as how it can reduce the risk of many health conditions as well.
And I think there's more phytoestrogens in a glass of beer than in a glass of soy milk also.
Yeah.
So if you're really concerned about phytoestrogens, then
Yeah.
there's that.
Very, very good. Very, very interesting. So there also, you mentioned iron at the beginning, Dr. Patel, being something that would be a concern and something to watch out for. We've had several questions about iron and how would we get enough iron from foods? Are there specific iron-rich foods that you would recommend kind of across the spectrum? We had people asking like, okay, as I'm weaning my child, from breast milk or from being bottle fed, to leafy greens and things like that. How do I do that? And then how do I get enough for my teenagers? Any thoughts on whole foods that contain lots of iron?
I mean, there's a variety of foods, but when we're thinking about different foods, I always like our legumes as a really great source of iron because not only are we going to get iron, we also get protein as well. But I would say really focusing on that. And, even for me, like having in my journey for the last 20 years of like refining and improving my diet, but just the breadth of legumes that are out there. I come from an Indian background, and so in India, legumes are such a big part of the diet because just naturally the society or the culture emphasizes more of a vegetarian diet. And just learning about all the different types of lentils has been just mind-blowing for me. So I would just encourage, we're happy to give people more information on the varieties of legumes and lentils. But again, that starting there is a really great source for iron.
Yeah, and the beauty of the different types of lentils is like a red lentil, for instance, when you cook it, it's really pasty, so it's good for little kids to eat. Babies can eat lentils smushed up and cooked in a paste, so it's a great source of protein, carbohydrate, iron, and all kinds of different vitamins. So yeah, that was excellent point with the lentils.
Okay. Also, there are quite a few questions about omega-3. So obviously what you're telling us is that fish oil is not necessarily where we want to be getting our omega-3s, but people are wondering about omega-3 supplementation, like for very small children all the way up through teens. What are your thoughts on that?
Leigh, go ahead.
Okay, I'm not so worried about the omega-3s. This is a little complicated. I usually have drawings when I explain this, but what's actually more concerning is the omega-6 to omega-3 ratio, that a high omega-6 to omega-3 ratio is concerning for promoting diseases. And so what you get the omega-6s a lot from animal products. You need some because it's part of your inflammatory system, which helps you fight infection and wound healing and things like that. So you definitely need some omega-6s, but you need some omega-3s, which are the anti-inflammatories, in a good balance ratio. And it's thought to be like a 4-to-1, 4 of the 6 and 3 of the 4 of the 6 and 1 of the 3. But the typical American diet, the standard American diet, is 16-to-1, much more pro-inflammatory. And so what they would have you believe, advertise, is to get that 4-to-1 ratio to boost your fish oil. So it becomes, instead of 16-to-1, 16-to-4, right?
Yes.
So that you get that 4-to-1 ratio. But as plant-based eaters, we're eating so much less omega-6 that instead of raising our denominator, we're lowering our numerator. So we get to the 4-to-1 ratio by taking away all the animal products up top on that ratio. So I'm not as concerned about supplementing omega-3s to boost the denominator when I'm lowering the numerator. Does that make sense?
It does. It does.
And what would you say to parents there's quite a few questions about how much protein should my child get? How much calcium should my child get? How much, do parents need to be concerned about these, how many grams or this ratio, if they're eating a varied whole food, plant-based pattern?
In regards to protein definitely the requirement differs as like the growth and development the years, change. So for example, like in the first 6 months of our life, the protein requirement is the highest, and it gradually, decreases as we go through childhood into teen years. Now, obviously, there's the exception of, for if you're a very like high performing athlete, higher requirements, there's different exceptions. But I guess as a general principle is that once we know, just know that that protein is based on our weight, and so it's not going to be a one size fits all. But once we, we're happy to provide the kind of the guidelines for what it looks like based on weight. That's very easy to determine. And then, once we know that, just trying to make sure that the food requirements are meeting that. And usually, generally, it's not an issue. But again, just recognizing that the protein requirement changes through childhood into our teen years, and then really is pretty consistent from kind of late teens right throughout adulthood.
Sure.
And then changes again when you get older, elderly, they have higher protein requirement. But again, just seeing that there's different stages of life where protein requirements differ.
I would just like to add, so if you're really concerned, there's a free program online called Chronometer, Chrono, and you can enter in the foods you eat all day, and then it'll tell you exactly how much protein and calories and 82 different micronutrients. Are you getting enough copper? Are you getting enough selenium? And you can look and see. And when I've done this with families, even plant-based families, then the numbers are astronomical. We're getting 200% of that, 180% of that. Like, if anything, in this country, we have a problem with overconsumption. There's not many people walking around unless you have a particular gastrointestinal illness or HIV or cachexia or cancer. There's just not many people around that are healthy, otherwise healthy, that are running into problems with deficiencies. So you can reassure yourself with this program, but then if you really want some insurance, the message isn't that you need to go out and eat animal products. There's health food stores full of vitamins and minerals and supplements and things like that. And just for a few bucks a year, you can take whatever vitamin or mineral or some supplement that you're worried about. You don't need to go after the animal products to meet that need if you want a little insurance.
Yeah, and I think what most people will find if they do the chronometer for, a few days or a week or two, they'll abandon it because they see, you know what, I'm getting everything I need. It's just kind of reassurance. But whole food plant-based, if you, as Dr. Patel used the phrase, well planned, if it's well planned and balanced, you're going to get everything you need, all the protein, all the carbohydrate, all the fat, and in fact, you're going to get more of the nutrients than you get with a carnivore diet. So yeah.
Well, here's a question that is different from all of these. There's someone who's kind of wondering, okay, if you're focusing so much on nutrients and food and all this talk about that around children and adolescents, might that lead to eating disorders? And could all of this talk trigger something? Like, talk about that in what you see in your practices.
Yeah. So in 2023, the American Academy of Pediatrics put out a 100-page document talking about addressing obesity. And it was a change of heart because previously they said for kids, it's watch and wait. We don't want to intervene, but now they changed their mind and said, we're starting to see a lot of health effects of obesity, so we need to intervene. And there is several parts of that document where they kind of teach pediatricians the proper way, or the less a gentler way to talk about this. And there are studies that do show that when approached in a sensitive, thoughtful way, that you're not going to trigger eating disorders, that it behooves you as the primary care provider of a family to try to help with this medical problem, and here's how you can do it best. So there's that like backup from the American Academy of Pediatrics. And then there's also something interesting called the and there are studies that show that when they, like, for example, there was a study out of New Zealand where they looked at teenage girls and put them through a nutrition kind of program, and afterwards there was half the chance that they would engage in unhealthy dieting habits like over exercise or purging or laxatives or things like that. So when done properly, it can actually reduce the risk of eating disorders. And then there's another important a metric that's called the adolescent dieting scale, which looks at 8 ways that an adolescent is approaching their food and perhaps trying to lose weight. And of those 8, plant-based eating only really kind of goes along with 2 out of the 8. And the more of those 8 that adolescent is doing, the more likely they are to develop an eating disorder. And for the population that was studied that were only doing 2 out of 8, no chance of developing an eating disorder. That was considered like a healthier way to go about eating. So because the plant-based diet can be bountiful and not portion controlling, because the plant-based diet can be not reading labels, you're eating foods without labels. Potato and bananas don't have labels. So because you're not focusing on these other kind of criteria that are on the adolescent dieting scale, it's very reassuring that you won't be triggering an eating disorder. Hope that helps.
Very much. Dr. Patel, anything from you on that, or should I move on?
Just that, there's been a lot of research into this area of like plant-based diets the cause for eating disorders, and that's been definitely established that it's not. But however, they found in the research that those with after the diagnosis of the eating disorder, they found that these people happen to have more of like a vegetarian diet, and so while the prevalence may be higher in this population, it's not the cause for the condition, the eating disorder.
That makes sense.
Yes, most of the people that were in the eating disorder clinics who identified as vegetarian in the study that I saw, they were actually developed the eating disorder first, and then kind of found vegetarian or veganism as a way to justify their restrictive eating patterns.
Yeah.
That came later. It's not like the vegetarian kind of triggered the eating disorder, but it seemed to be the other way around in the study.
Yeah, that makes a lot of sense. I'm going to ask one last question because I know that Dr. Holly's looking at me saying time.
No.
Let's end with picky eaters. Okay, how many times do you hear from families, my child is a picky eater, what do I do? So there are parents that say, you're talking about the rainbow and you're talking about variety and all of that, but my child, variety is not on their radar. They have a very set, talk about those stages of eating, and should it be worrisome for a parent if they're in that phase, or will they move out of it? Just kind of give parents a little bit of insight into picky eating and whole food plant-based eating.
I'll go ahead. Yeah. So
Okay.
I think the first thing I wanted to mention on that front is that we have really good research and data to show that that consistency is the key, that not to be discouraged with sometimes picky behaviors, where sometimes it takes, like I tell families, 8, 10, 15 times of just being consistent of introducing the same, food, but that eventually, kids will take it. I think that's one important aspect to emphasize with families when they're, dealing with picky eaters. And I know it is definitely not easy, and it's hard when the efforts are consistently being kind of, rebuffed by children. But, this idea of consistency is really important. I think second, a lot of research to show that actually one of the number one factors to get kids eating more like fruits, vegetables is the parents' own consumption of fruits and vegetables. So again, just hitting that point of parent and modeling and being the example, I think there are two just simple points that I wanted to share with the audience on how we can help address this.
Thank you. Dr.
Just
Ettinger?
like, can I add? Yeah. So the child is evolutionary programmed to seek out higher calorie density foods. And there have been studies that show that the kid's food preferences directly lines up with the calorie density. So they're thinking the child is being a picky eater because they are trying to survive. and they're kind of negotiating. And if they say no to this fruit or vegetable, they know that a higher calorie density food is going to be offered instead. So it's not necessarily that they're picky eating, they're negotiating, and they're negotiating from a stance of survival evolutionarily. So what I try to educate families about is something called the Ellen Satter division of responsibility. And there's books about this and websites and information that I give the family. But basically, it says that the parent has a decision of what is eaten and when it's eaten, and the child has a decision of how much is going to be eaten. So you put out the food that you've made for the child or prepared for the child, and they can say, oh, I love this. I'm going to eat seconds. I'm going to eat thirds. I'm going to eat fourths. That's fine because you've decided that's a healthy meal or snack. Or they say, I'm not going to eat that. And then they're not going to eat. And they're not going to eat until the next time that it's been decided when snack or meal time is. And initially there'll be conflict because the child's going to be hungry and angry about this situation. But ultimately they'll learn that all that is being offered is what's in front of them. And if they don't eat that, they're going to be hungry until the next designated snack or meal time. And so there's no more negotiating. And initially there will be conflict, but ultimately the goal will be actually less conflict because the child knows what is available and what is not available. So that's one thing that I try to work with the families on.
Great
So
point, Lee.
I hear you both saying that, parents, it's that modeling piece that's so important. It's like choosing healthy options for the child and then being consistent with introducing those, even though that conflict may arise and that causes tension for everybody.
Yeah, and I would just add to that, when it's age appropriate and time available, involving the child in preparation, choice of
Yeah.
foods is definitely helpful because when they have some say so, they're much more likely to eat when they have some say so in the food. So, but that's, age appropriate and time. Families nowadays, time is a diminishing. So anyway, well,
Well, I'm going to leave it there and we could go on for the next 4 hours, I think, and continue talking, this is exciting. So maybe there might have to be a part 2 sometime down the road here.
yeah, I'd love to have Dr. Ettinger and Dr. Patel back. You guys have filled us with so much wisdom and really, really appreciate your time tonight. We appreciate the Canadian contribution from the North, and we appreciate the New Yorker from Kingston, New York, Dr. Ettinger. So thank you again for sharing your expertise with us. Look in your emails in the next couple of weeks. You're going to see some information about our next Spotlight on Health next month. We're going to talk with a rocket scientist turned plant-based lifestyle physician. Dr. Nikki Davis is going to be with us. So look for that information. Look for that replay email next week. And Natasha will give you some information on the studies and Dr. Patel's website and lots of little goodies there for you to read. On behalf of the T. Colin Campbell Center for Nutrition Studies, this has been Spotlight on Health. Thank you for joining us. We'll see you next month. Bye-bye.
Great. Thank you, everyone.
Thanks.
Have a good evening.